Hello, Marwan Aburas here. Welcome to R4, the final and most revealing phase of the 4R operational diagnosis protocol. This is where it all comes together, where a hidden crack is discovered, an untreated root canal is identified, or a recurrent caries exposes the true cause of the patient pain. In R4, the diagnosis becomes definitive, and the clinical decision-making becomes so clear because you see everything. We begin with restorative assessment. This is very important, guided by the 2023 FDI criteria. This is a gold standard for evaluating both restorations, intracoronal, extracoronal, direct, indirect. I have two presentations here. The first explains the criteria, 2010 and 2023. The second, how I apply them in my practice to the cases I find, with re-explanation with clinical. Everything is endodontically oriented, endodontically relevant, margins, integrity, retentions, contour, embrasures, all of that. Once the restorative review is completed, now we come to tooth structure. We shift to the physical clues. Often you see, and in these physical clues is all the diagnosis. So what do we see? Here we look at and focus on endodontic relevance of tooth discoloration. Discoloration because of pulp necrosis, endodontic treatment failure, internal resorption, all of that. And then we go to the issue that every color has a story. And most of these stories, as I told you, they always endodontically or restoratively relevant. Then we go to tooth cracks. In this section, I will share with you my classification. I call it the 3x3, which I have designed to differentiate between the different kinds of cracks. There's a crack, there's a fissure, there's a fracture. You will learn how to distinguish between those and which one is pathogenic and which one is not pathological. From there, we go to tooth surface wear, erosion, attrition, abrasion, and all how they affect the dentin and the pulp. Their impact on occlusion, on dentin, on pulp is so important and underestimated in our education. After that, I go to dental anomalies, the dense indenti, the palatal groove, the dense invaginatus, dense evaginatus, all of that. And then from there, we go to occlusion and alignment. The journey ends. You place the temporary, and now it's time to sit down with the patient. You sit down with the patient, you explain what you have found clearly, confidentially, and compassionately. You know why? Because now you understand everything about this tooth or teeth. You have read their story so well. You've seen the map, you've seen the landmarks. You understand everything about this tooth and what it has gone through. And that, my colleagues, is what makes your diagnosis and your treatment the best, smarter, faster, and more reliable.